Hi, my name is Mark Bryant and I'm part of the production team for a groundbreaking online course that focuses on Muslim mental health, being developed here at Cardiff University by the Centre for the Study of Islam in the UK. The Islam UK Centre, as we're more commonly known, is a research centre that takes an interdisciplinary approach to the lived experiences of Muslims living in Britain today. We have a strong track record of undertaking interdisciplinary research on a wide range of subjects connected to the lives of Muslims in Britain, including Muslim chaplaincy, the religious nurture and education of Muslim children, Islamic environmentalism, and the intersection of religious courts with civil family law. We specialise in qualitative social scientific methodologies and emphasise active collaboration with our research participants. We're currently working on a new course exploring mental health in Muslim communities. To provide you with a taster of what the course is all about, I've been chatting to Dr Asma Khan and Shaykh Dr Asim Yusuf about the reasons for developing this course and the importance of the topics we'll explore. We're fortunate to have Dr Asma Khan as Research Fellow on this project, and I recently asked her about the Centre's involvement and the rationale of the course. Hi Asma, I know it's always awkward, but can you tell us a little bit about yourself?
Okay, so I've been working with the Islam UK Centre since 2008 as a research assistant and as a PhD student. I completed my PhD at the Centre in 2018, looking at the economic inactivity of British Muslim women.
Thank you. And what would you say your role will be in the course?
So as the research fellow on the project of developing the course, I'm going to be working with Sophie on the day-to-day management of the course, and I'll also have particular responsibility for the production of academic content. My own research interests are focused on the socio-economic inequalities faced by ethnic and religious minorities in Britain. So what I bring to the course is a contextualized understanding of how of some of the inequalities that British Muslims face in Britain.
Well, that sounds great. And who would you say the course is for?
The course is intended to be a practical and theoretical resource for mental health practitioners and for those who provide pastoral support from a religious perspective. So people like imams, chaplains, mental health nurses and doctors. We're also going to design the course in a way that makes it accessible to the wider public too.
So can you tell me a little bit about how this course came about?
Okay, so the course is an outcome of a joint event held between the Islam UK Centre and Mind in Wales, which is a mental health charity. Arising from the Centre's research on chaplaincy and pastoral care in Muslim communities, we invited Shaykh Dr Asim Yusuf to deliver a lecture for us in partnership with Mind in 2018. The popularity and interest in this event signalled to us the need to develop accessible learning resources to support the work of chaplains, mental health nurses, imams and doctors and other similar health and pastoral carers in their engagement with Muslim clients.
What would you say was the rationale behind the course?
So we recognise that the religious worldview and practices of Muslims might be a significant source of comfort and well-being for them. We also recognise that Muslims might face particular socio-economic and circumstantial pressures, especially for those living as minorities. For example, Islamophobia, racial prejudice, refugee status, and experiences of civil conflict overseas may lead to particular kinds of mental ill health. Meanwhile, like members of the general population, Muslims can experience and suffer from common mental health disorders such as stress, depression, and anxiety.
So our course lead is Professor Kilia Ray. Can you tell us a little bit about Sophie?
So Sophie is the founding director of the Islam UK Centre, and her research focuses on the social scientific and anthropological study of religion in public life in Britain. Sophie has conducted extensive research on chaplaincy, especially in prisons and hospitals, since 1994.
So, what in your opinion makes the Islam UK Centre best suited to develop such a course?
So I think the Islam UK Centre is really well placed to develop and deliver this course because of our strong track record in conducting research with chaplains and imams. We also have a really wide-ranging network of professionals, practitioners, and academics to call upon to contribute to and shape the course. The Islam UK Centre has a track record of producing successful online courses. We have expertise in producing engaging and interactive online learning experiences.
Finally, we'll have many different experts on this course and will benefit from a wide spectrum of perspectives. We're particularly fortunate to have Shaykh Dr Asim Yusuf as lead consultant on this course. Can you tell me a little bit about him?
So yes, you're right, Mark. We are honoured to have Dr Yusuf joining us on the course to lead on the development of theoretical and theological content. Dr Yusuf is a practicing consultant psychiatrist and an Islamic scholar with a special interest in spirituality and mental health. He has authored a number of works on spirituality, history, and Islamic law. Dr Yusuf sits on the boards of a number of charities and community initiatives.
Thank you, Asma. When I spoke to Dr Yusuf, I started by asking him why he feels a course on mental health in Muslim communities is important.
Thanks for asking that question. I think it's a really important one. I think over the years, and I've seen as a psychiatrist and somebody working in the field, that there's been more and more emphasis and importance given to a person's mental health. When I started out, which was probably about 20 years ago now, there were still some topics, even in the mainstream community, that were really not for polite conversation, you might say. So you know, we couldn't really talk about mental health. You know, certain segments of the community couldn't talk about being depressed or being anxious and so forth. There's been, I think, a greater public awareness in mainstream society about the reality of mental illness, mental distress, and therefore the importance of preserving and sorting out one's mental health. That has not necessarily translated to all parts of the community. And I think that in the ethnic minorities, and in particular here in the Muslim community, I think there remains quite a lot of opacity to the concept of mental health and mental illness, as well as the specific ways culturally, ethnically, and religiously that mental distress is experienced. Because of that, there is a hesitancy to come forward into the mental health services, but there is also, I think, a feeling of disempowerment among professionals, whether they be the GPs at primary care, who are often the first people to encounter people with mental health problems, or with specialists and carers and so forth. There's a feeling of disempowerment that there's a gap almost, that I don't know how to bridge this gap between my understanding of, if you like, universal human mental health and mental illness, and this specific cultural or religious manifestation of it. Put that another way, we find that in Muslim communities, people come forward less often, later, and with more serious manifestations of mental health problems. What that means is both that they are more difficult to manage and treat, but also that their families take on a significant burden before they even come to the attention of professionals. We also find that Muslim patients from a Muslim background don't do as well with things like psychotherapy, because these are based on constructs that at the time in the late 20th century were considered to be universal human constructs. But we've since realized that actually there is no universality to the DSM-4 or to the ICD-10, that there are specific cultural manifestations of mental health problems that need to be approached in a specific way. So there is Muslims, as with any other group in the community, suffer with mental health problems, but they tend to suffer in particular ways, to understand their mental distress using particular frameworks, and experience certain types of mental health problems more often or more frequently because of either religious, cultural, or social factors. So the benefit of a course like this actually is to really firstly empower professionals with a basic understanding of that framework, also to look at what the Islamic tradition has done about mental health problems and steps that it has taken to bring about positive mental health, historically, some of which are still in operation, and really how to bring those two streams together to optimize a Muslim person's experience of their mental health, to ameliorate forms of distress that they are experiencing, to help them to engage better with different types of treatment, but also to give professionals a real insight into into the manifestations of mental health problems in Muslim communities, but also some of the resources that exist in the community and in the tradition to help them get through it. So really to connect. I think that's probably in a word, he says at the end of all of that, in a word, it is to connect together the service user and the service deliverer in a way that is culturally, religiously appropriate.
Thank you for that. So, who would you say would find this course helpful, and is it open to Muslims and non-Muslims?
So to answer the second question first, the course is absolutely open to Muslims and non-Muslims. No prior knowledge is assumed or expected. And we, in fact, encourage both Muslim and non-Muslims to attend this course, and we think everybody will find it useful. In terms of who it's aimed at, it is primarily aimed at health professionals who will be working with, or who may come into contact with, Muslim clients. That's really the way that the course is designed and aimed. Of course, service users, carers, and so forth are welcome to attend it and will find a benefit in it, absolutely. But the reason that we've aimed it at health professionals is to ensure the widest possible impact. So it may be that 100 people or 1,000 people or 5,000 people attend this course. But if we can get 500 healthcare professionals, each of whom will be in contact with 50 patients from that community, you've now actually brought the benefit to 25,000 people. So that's why we're aiming it at these nexus points, which are the healthcare professionals more than anything else.
So, what are some of the things that learners will find out about?
So what we want to do in this course is cover a fairly broad range of topics, and give a fairly cursory overview of a number of things, and yet go into depth about certain critical core concepts. So what learners will find out about is firstly the experience of mental health conditions in Muslim communities, which I think is really critical. Looking at how a Muslim person might experience a mental health condition, how they might understand it, what sort of frameworks they bring to that understanding, whether religious frameworks, cultural frameworks, and so forth, views that are out there in the community, the types of support that they may receive or not receive in the community, so that you get a sense of what is happening on the ground and what is happening in people's homes, which sometimes doesn't really make it to the clinic, as it were. Then it's about looking at the Islamic component, if you like, of their understanding. So what does Islam have to say about mental health issues and mental problems? What resources are there within the tradition to go about helping you and to treat it, and so forth? And this one of the things, for example, that we'll explore here is the difference between what you might call what is the difference between mental health and spiritual health? How does a Muslim person understand the concept of mind as distinct from spirit or soul? And this is something that is often quite a stumbling block, actually. And it's really a stumbling block about terminology. And if you can get over that stumbling block, it really opens up a great deal of pathways to actually to recovery. So concepts like the nature of mental, what do we mean by mental? What do we mean by health? What resources are there in the Islamic tradition about dealing with health problems generally, mental health problems specifically? What is the relationship between a depression or anxiety and one's belief in God, or one's idea of one's own purpose? These types of things are fundamental questions that Muslim people have when they experience mental health problems, but they often find quite difficult to talk about, especially to a professional, and especially if they feel that that professional doesn't really understand where religiously they're coming from. So there'll be a bit of a focus on that, so that a professional can demonstrate some sort of sympathy, understanding of that framework, and then and really allow the person, the client in front of them, to open up. We'll also then look at avenues of treatment, and we'll talk about the holistic and the biopsychosocial model, with an addition, which is the spiritual elements as well, which are extremely important for a Muslim person, as well as an understanding of the types of resources that exist in the community, and how to access those resources in a safe way. At the same time, how to encourage those clients to access the resources that exist in the NHS, in mainstream communities, in third sector organizations, as well as to build up, especially the third sector, mosques, imams, and so forth, to build up those types of resources in the community. So yes, it will cover a broad range. One of the things that we will do, for example, is look into a little bit of the history of the understandings of mental health problems in the Muslim community, sort of historically, and that there is, spoiler alert, but there is a sophisticated 1,000-year-long tradition of psychotherapy in the Muslim community, and it has a number of different branches and a number of different approaches, some of which tie in very well to models like CBT, like transactional analysis, and so forth. So, as well as actually to the concept of medication, taking medication. So, as one figure who we'll talk about, Abu Zayd Balkhi, who was basically a public intellectual with a real interest in health, and he was in the 9th century Baghdad, so you're talking 1,000 years ago, who produced a typology of mental health problems that reads almost like a DSM manual, effectively. We'll talk about that in the course. His suggestions for preventative mental health, which is something that has a long tradition in the community, in the Muslim community, and something that is actually very beneficial for us to understand as well. So preventing a mental health problem before it kicks off. And then his suggestions for self-help, as well as when professional help is needed, and how to go about accessing it. Now, that's really important, because that problem, the barrier of access, the importance of seeking the help of an expert or a professional, is something that is often something that a community like this could really benefit from, understanding, really benefit from knowing that actually this comes not just from their GP surgery or something, but comes from their own tradition. So we'll talk in a little bit of depth about those sorts of ideas as well. So there's a lot to take from the course, all in all, and it will cover quite a broad range of topics in hopefully exciting and interactive ways.
So, can you tell us a little bit about your own background and what you think you'll be bringing to the course?
Right. So I hope I bring something to the course that's beneficial. That's the first point, I suppose. So a little bit about me. So I am a consultant psychiatrist. I've been a consultant for over 10 years. I've worked with very mixed populations and have encountered lots of cultural variations in understanding of mental health and so forth. But I've been doing this for a long time. I'm also a religious scholar. I am the chair of the British Board of Scholars and Imams, which actually recently has produced a mental health toolkit for imams to help train up imams in awareness of mental health difficulties and problems, which is being rolled out actually at the moment, and hopefully will continue. And in my particular interest from a religious perspective, my specialization, you might say, which brings my two halves together, my two hats, my psychiatrist, if you like, my psychiatrist stethoscope and my scholarly turban. What brings them together is an interest in spirituality and mental health. So I have done a lot of research into the Muslim spiritual and psychological traditions, as well as into the, if you like, the deeper philosophy that underpins those traditions, both from a Western perspective as well as from an Islamic perspective, tackling questions like, what do we mean by health? What do we mean by recovery? What do we mean by mind or by soul? And how do you bring those two things together? So I've written papers and book chapters on those sorts of topics, as well as developed forms of therapy, so practical psychotherapy, if you like, that bring together these concepts and allow a, if you like, an indigenously Islamically informed approach to psychotherapy that seems to go down quite well with Muslim clientele. So that's sort of my own perspective in terms of my own background. It's something that I've spent the last 20 years doing. I'm also someone who has been trained in the Islamic spiritual traditions for probably even longer than I've been a doctor, actually. So I'm quite well grounded in that as well, which is where you find a lot of those resources about mental health and spiritual health as well. However, I think that in addition to that, what I bring with me is contacts, and I bring, a number of people who are like me, are, if you like, dual trained. So they are trained in the Western science of psychology, psychotherapy, and psychiatry, but are also trained in the Islamic sciences as well, and have had a similar experience to me, and bring that all to the table. So there's a lot of experiential resource and theoretical resource that you'll find in the course. People who've had, I sometimes say that there are three aspects to this. There is the academic stuff, which is, if you like, the kind of the intellectual underpinnings of the particular discipline, whether that be the Islamic side of things or the theory of psychology from a Western perspective. There is the clinical aspect, which is the skills and the tools that you bring to bear, so you can actually, wield all this theory into practicable psychotherapies, medication protocols and regimes and so forth to help a person. But then there is a third aspect, and that third aspect is the experience of actually doing so. So the experience of seeing those clients, listening to them, learning from them, and bringing that, folding that back into your practice. So I think I bring that. I have those three bases, and there are others on this course who you'll hear from as well, who also have those three bases, which give you a nice stable stable base, if you like. The minimum number of legs a chair can have. Leave the one with the central leg in the middle, but the minimum number of legs is 3. If you've got 3 legs, the stool can sit. You can sit comfortably on a stool. So I think those 3 things in the right measure and the right proportion is something that you will find, hopefully from myself, but also certainly from the other experts that are on this course, and who you will be hearing from on this course. So there is the transmission of the patient voice, I think, which is something that's incredibly important, that is channeled through those who have had experience, people like me who've had experience with them. There is also the transmission of the religious and cultural voice through the tradition from those who are expert in the tradition. And then there is the transmission of the clinical voice, which is again, we are not bereft of that either, having had, many years and decades of practice in that as well. So hopefully with these three voices, we will be able to allow you to hear that experience of an individual Muslim person in the 21st century experiencing a mental health problem, or the experience of their family caring for them, but also the echoes of 1,000-year tradition of mental health, spiritual health, from a theological and from a religious perspective, as well as, of course, what most of you, I think, will be familiar with, which is the clinical side of things, and how we bring those things together. We see this sometimes. You talk about in football sometimes. You talk about a team of individuals versus a team that plays together, and really what you're looking for is a team that plays together. It's great having these separate resources, but unless they're linked together, unless they talk to each other and inform one another, they're just individual things. And sometimes they can get in the way. That's the difference between too many cooks spoiling the broth and many hands making light work, is that the cooks often work in opposition to each other, whereas the many hands work together. And we hope that what this course does is bring those many hands together to make light work out of what is an incredibly important responsibility that we all carry.
You've talked about the British Muslim experience, but this course is open to a global audience. So will the content be useful to people outside of the UK?
So this course certainly, I think, is universal in scope, in the sense that it's something that anybody dealing with these particular issues anywhere around the world would benefit from, because ultimately what it is about is bringing together two great traditions. You've got the Islamic tradition and the Muslim experience of mental health issues, and you've got the Western tradition, which is practiced all around the world in terms of clinical practice. And these two things are universal wherever you'll find Muslims and wherever you will find psychotherapists, psychologists, doctors, psychiatrists. You will find these two traditions. So from that perspective, yes, there is a huge amount that anybody would be able to take from this course. There is nothing specifically British about the experience of Muslim mental health crises, distress or recovery. That's probably one exception to that, which is about the types of resources that are available. Of course, when we're talking about the resources available here, we are largely talking about the resources available in the British context, particularly, of course, the NHS, which is something that, British people can never stop banging on about how proud they are of the NHS, but we are, and justifiably so. But with the exception of that, and it should also be said actually that some of these resources would also be available internationally. So you would be able to, if you were logging in from Germany, or you were logging in from the States, or you were logging in from Singapore, of course, there is, what resources you have available would depend on your context. But if you have Muslim clients, and if you have that psychotherapeutic background, then you would certainly find a lot to benefit from this course, and a lot that would improve and assist your own clinical practice when dealing with such clients.
That's great, thank you. And why have you decided to be involved in the development of this course?
So I've, over the years, worked with the Islam UK Centre for the Study of Islam in the UK a number of times, and I've been consistently impressed with both their professionalism, but also their sincere desire to improve the circumstance of Muslims in the UK from a number of different perspectives. It's something I've always been humbled by and impressed by, and I'm very happy to be working with them in this particular project. The reason that this project was attracted me or something I was very interested in was precisely because of the potential reach and therefore the potential to bring a maximum amount of benefit to the maximum number of people. I am very aware of how much of an issue mental health is in all communities, and particularly in my own community, the Muslim community. I'm equally painfully aware of the barriers that exist, both to their accessing of the resources that are available, but also sometimes the paucity or the unpreparedness of those resources to deal with their specific issues or to speak to them in a language that they understand effectively. So I really jumped on this. I really sort of jumped on this with both feet, because I thought here is an opportunity to really start to bring these two elements together, to bring about what you might call a Muslim sensitive approach to mental health, where practitioners feel confident to be confident enough to be sensitive. They have sufficient background understanding to be sensitive to and to have some knowledge of what their clients are talking about, and therefore to allow those clients to open up to them in a way that is required in order for you to have a therapeutic relationship. So I really saw a tremendous benefit in doing so. There is a huge need out there. And I know from my colleagues, my professional colleagues, who come and ask me individually, look, I've got this client, they've mentioned this point, I'm not really sure what to do with this. So I'm very well aware of sometimes the lack of confidence that a professional feels when dealing with somebody from a different faith, from a different culture, that am I really getting to the core of what the issue is with this person? I hope that this will be successful. I'm sure it will be. But I also hope that it provides a model for other faiths, especially BME communities, to do the same sort of thing. So I would like to see this course being used as a model for looking at Hindu mental health or evangelical Christian mental health, for example. And to bring so that people can really avail themselves of the great deal of resources that are out there, but do so in a real way, so that their mental health does not just devolve to medication and see a doctor in a few weeks' time. The psychotherapy, the opportunity to engage in psychotherapy, no matter what the model, is the opportunity, and I know I'm preaching to the converted, but is the opportunity to be listened to be understood, to be validated by another person for an hour a week for 12 weeks, let's say, at a minimum. And even that opportunity is sometimes not taken up by people from a Muslim background because they assume that the therapist won't understand, or that the therapist themselves is not aware of how to, does not have the requisite background knowledge to be able to make that client feel at ease and so take the full benefit from their experience. So this is one of the reasons that the course really appealed to me, and something that I hope will prove to be of benefit, will yield fruit really, and yield fruit very widely. So that's why I was interested in getting involved in this, and I hope we can manage to do that.
So what will learners have at the end of this course?
So this is an introductory course. The aim of it is to really raise awareness, to give you the basic tools of that sort of cultural and religious competency when you're dealing with a client or a family member with mental distress. And I think in that sense, it will give you a sense of confidence that will allow you to reassure the clients that you're seeing that you do really understand where they're coming from, and also to give them some sort of information about the resources available to them in their own religious tradition, which they may be unaware of. So that I think is from a professional perspective, or if you're a chaplain, you're a school teacher, you're a carer of somebody. Even I think it's knowledge is power. And I think that it's incredibly important that we have that at our disposal. There is also the opportunity, of course, to then take that further for those interested in a deeper understanding of these issues, and of some of the Islamic elements, the historical elements, as well as more contemporary manifestations, things like Islamic psychotherapy models and so forth. Then there's the potential to develop future courses which look into these in a lot more depth, and actually can really go about providing a degree of competence in practice, you might say, how to go about informing your practice of CBT from an Islamic perspective to really help your clients buy into it in a very real way, for example, and that type of thing. So I think that there is plenty of scope. This is as Winston Churchill said, it's not the end, it's not even the beginning of the end, but it is the end of the beginning. And I think that's really the approach that we want to take, to open up the vista, and then to allow exploration of it thereafter. But if you only do this course, I think that you will end up with a real sense of confidence and understanding that you will be able to radiate to your clients or to those around you about the Muslim experience of mental health problems and mental distress, and also the resources that are available to them within their own tradition, and how those resources link in to the approaches that we take in professional practice.
So thank you so much for that. Finally, is there anything else you'd like to tell us about the course?
Lots, but you'll have to attend the course to find out what those things are. But there's two things, I think. The first is, we've spoken about who deals with Muslim mental health problems. And I've spoken a lot here about professionals. But I think we need to bear in mind that lots of people come into contact with those suffering mental health problems. And lots of people will come into contact with with Muslims suffering mental health problems. Yes, there are health professionals, but there are also school teachers. There are also chaplains, for example, who go into hospitals or go into prisons and so forth, who will encounter exactly these same issues. And I think you will also find a benefit from this course, that you'll be able to take away and implement in your practice. So if you are a person who comes into contact with those with Muslim clients or Muslim people experiencing mental health problems, I think you will find something in this course that will commend itself to you and that you will be able to take benefit from. And I would very much encourage you to invest the time and come and learn about this, and come and learn about this experience, but also this grand tradition of dealing with mental health difficulties from what you might call the Islamicate world, and learn something about the very rich history of that particular tradition. The last thing, I suppose, and I would be remiss talking about Muslim mental health if I didn't mention, yes, we will be talking about jinn and black magic. So there will be an element in the course that will relate to something that you have become, either that your client is comfortable with you, or that they've become psychotic if they tell you that they think that the problem is because of a jinn, or because the problem is because of someone has done black magic on them. Now you know that client is comfortable with you. And we will talk about this element of Muslim experience of certain mental health problems and how to deal with it, how to demonstrate understanding and sympathy towards it, but also how to wrap it into the work that you are doing. So how to take it on board, take that client's view on board in a way that is genuine, but wrap it into the therapy that you are doing. People like myself, over the 20 odd years I've been a psychiatrist, have had hundreds of encounters with exactly this question. Sometimes when offering a patient a medication, sometimes when offering them therapy, and so forth. And it's a really important element of many Muslim persons, many a Muslim person's experience of mental health problems, that it's important for you to know about, but also important for you to know how to deal with in the context of a therapeutic encounter. So yes, we will be dealing with ghosts, goblins, ghouls, and witches.
Thank you for your time, Dr. Yusuf. I hope you found this taster interesting, and we've provided some useful background to the importance of well-being and mental health in the Muslim community. We're very interested in your feedback to help us develop the course, so we'd appreciate it if you could take 5 minutes to complete the short survey that we've sent with this video. If you'd like to keep in touch with what we're up to, you can follow us on Twitter and Facebook. Thank you very much for watching.